So now I'd like to hand over to our final speaker for the day. Really delighted to introduce Foluke Ajayi. We haven't met before, Foluke, but I've heard such super duper things about you. Foluke is the Director of Strategic Transformation, NHS England and Improvement across North East and Yorkshire, and she's also Locality Director for the Humber Coast and Vale Integrated Care System. So thanks, Foluke, for joining us, and really interested to hear about your presentation entitled Skin. Over to you, Foluke.
Thanks, Louise, and hello, everybody. You can tell I have the longest job title going. I'm still learning to embrace it. As I go into this presentation, I just share a little bit about myself. I'm Nigerian born and came to the UK when I was 12 with my family, and did normal things that everybody else did, went to university, studied biological sciences, and then worked as a clinical scientist for about 10 years in the NHS, working predominantly with children with hearing difficulties, working with cochlear implants, so a lot of tech involved in that work at the time. I then moved on to work in the Department of Health, initially on workforce development, recruitment and retention, and then worked also as Deputy to the Chief Scientific Officer, before then going to NHS Employers and continuing my career as head of NHS Careers, which is all about attracting people to work in the NHS and working with a range of people, schools, getting the NHS into the school's curriculum, as well as working with universities, working with the Department for International Development, and so a whole range of workforce issues. I then sort of developed some HR skills and worked on some of the NHS reorganisations, as we like to do in the NHS, and led some of those reorganisations for a while, particularly around PCTs and SHAs as there were. Went into frontline management and was an operational manager and was the general manager for the Leeds Cancer Centre in Leeds, an internationally renowned cancer centre. And then prior to joining NHS Improvement and NHS England and Improvement, my current role, I was Chief Operating Officer at Morecambe Bay Hospitals for 5 years. I tell you all of that, particularly on the back of the conversations we've just heard about the freedoms for people to move around in their careers, the fairness that's required to enable people to do that, just to demonstrate that it is possible. My career has not gone to the plan that I had, neither am I disappointed about that, actually. I'm really pleased about the things I've been able to do. But my ability to have achieved what I've achieved today and to be where I am today hasn't come easy, I have to say. And therefore, you might be wondering, well, why is her presentation entitled Skin? I want to take this conversation back to brass tacks, to really bring it back to the basis of what we're talking about. And the diversity I'm talking about in this context is really around racial diversity. I'm talking about the colour of your skin. That's really what this is about. And I thought, actually, what is skin? Why is this such a big deal? And as any good researcher will do, you go onto Google and see what Google has to say. And the skin is the largest organ in the body, and it has a square footage of about 20 square feet, and it's there to protect us from microbes and elements and regulate our body temperature, and also help us with our sensations of touch, heat and cold. That's what the skin does. And everybody has a skin, and the colour of your skin might be different to mine. The hue of your skin might be different to the next person. And so we talk about white skin, we talk about black skin, we might occasionally talk about brown skin. I've heard those from the Orient being referred to as yellow skin, but actually put two people together and their skin colour is not the same. Yet we are in an environment where there is a lot of drama over the colour of somebody's skin. And so for me, when I think about this agenda, I always think, are we clear that this is actually what we're doing? This is what this big issue is about. We don't have as much of a noise over your eye colour. or your hair colour. But for some reason, the colour of your skin seems to be an issue, yet that skin does exactly the same thing in the next person. So there's something about how do we get into this discussion that really enables us to think about how unusual and how irrational the challenges that we see that we put in front of people are, because people have a different colour skin. We don't put the same challenges in front of people because they happen to wear a different colour clothing, but we do it because they have a different colour skin. And for me, as we go through this, we have to remind ourselves, we need allies to also remind everybody that that's how ridiculous this is all about. And so my journey through all of this, I come from a background where I have always been championed. I have very supportive parents, very supportive family, and that makes a lot of difference. And so when people ask me, Foluke, how have you arrived at where you are so far? For me, it is because I have been encouraged. That's part of it. But part of it is also the comment that was made earlier by Samar when she said, don't wait to be asked, just take your own chair. And I've always done that. I've always pushed myself and been inquisitive and asked questions and positioned myself where I was interested and what I was interested in doing. And I think that's really important about how do we empower each other to do that, to ask questions, to explore the key issues, to explore the areas of interest, to propel people forward. But also one of my main mantras is around love. Now that might start to make some people feel uncomfortable on this call, and if that's the case, I'm really sorry. But I have to say that my approach to life is about loving everybody. And therefore, if you put that in the centre of what you do, and again, one of our speakers spoke earlier about kindness, if you put that in the centre of what you do, everything else becomes immaterial. Your focus is really about how do we achieve the best in terms of the ambitions that we have. If we're working together corporately on a particular issue, no matter what aspect of life we're in, then our focus is in how do we get the best out of each other to deliver the product, to deliver the service, to achieve the aims for our clients, for our patients, for our service users. And certainly as you do that, you also will then want the best for your co-workers, for your colleagues. You'll want the best for the people around you. And so for me, when I go back to skin, that's the point. It's just skin. That's all it is. There's nothing grand about it. Yes, it is grand because it protects us, but there's nothing more to it than just skin. That is all it does. It doesn't do anything else beyond that. We may have different cultures because of where we happen to have been brought up and the way we've been happen to be brought up. But in this day and age of multinational arrangements, a global world, actually we will find that we're all exposed to different cultures in many different ways. And one of the things that I think we also miss in terms of how we approach this diversity agenda is the richness that difference brings us. And a lot of people have talked about that already. The benefits that you get from looking at things from somebody else's perspective. Somebody who has come from a different background to you will see something different, will see an opportunity that you may not have spotted, may see a risk that you haven't spotted, and therefore actually there's an opportunity to propel and improve whatever it is you're trying to do. And so again, our ability just to accept things the way they are in terms of that person has a different colour skin, they have a different colour eyes to me. No big deal, let's get on and do the job. But actually they add something to you as you go into that journey and you talk about it. So my approach to life, my approach now on this whole agenda is how do I use my leadership to support those around me, regardless of where they come from, regardless of their background. It's about using my leadership to be inclusive, my leadership to say, it's okay for you to be here. How can I help you? And you want to go there? How can I help you get there? Or actually, how do I support those people that might be having a difficult time? How do I enable them to, how do I give them a voice to articulate the challenges that they are experiencing and then work with them and those who may be causing the difficulty for them to understand the difficulty that they're causing the next person. And that we start to break down those barriers and start to have these uncomfortable discussions. because I know for some people it's uncomfortable. I've had my fair share of discrimination as I've gone through my journey and through my career. I remember once standing in a conference centre in London. For those who know it, the Queen Elizabeth II Centre in Westminster, a massive conference centre. And I was standing in the lobby making a coffee, and a gentleman beside me looked down at me and said, 2 teas and a coffee and a coffee, please. Assumed I was there to make drinks. And I lingered long enough for him to ask me where his drinks were, and then politely told him, it's available for you to make yourself as I've made mine. That's just one example. Examples of attending meetings and people thinking I'm there because I'm there to take notes, or I happen to be in the wrong room. Was I invited? But for me, I look past those things and I educate those people as I go along to say, actually, you've made a mistake there and you need to think about what your first thought was. Somebody once, I remember, I was wanting to buy a plaster, and she said to me, oh, we have different colours here. We even have flesh coloured, and offered me something that looked very pink. And I had to remind her that that flesh colour depended on your skin colour. And so for me, it's about just reminding each other that actually these key issues are important, and they might seem minute, but actually they are important. But it comes back to this is skin, and the intellect, the ability of the individual behind a particular skin is not reflected by the colour of their skin. It's reflected by who they are, their experiences to date, and where they've been, and how we honour each other and respect each other through that process as we move this conversation on. I'm really pleased that this conversation has come to the fore, as it has done over the last 5 or 6 months, but there's much more work to be done. And so there's something about always stripping it back to brass tacks, just to say, how did we get here and what are the key issues and why is this so important? Because I do believe that the more we start to peel things back, the more we start to see that actually the things that we see as a big deal are not such a big deal. But on the other hand, we must make sure we don't stay stuck where we were before, where we disadvantage people just because we took a myopic approach to the way we do things. I'm going to leave it there in the interest of time, but happy to take questions and comments. Thank you.
Thank you so much, Foluke. What a lovely, you have such a lovely style for delivery. That was a really nice presentation to end on. It was really calming, and it was lovely, and really, you know, just getting it back to basics. You know, we're all the same. We're all flesh and blood. Let's just get on with it, please.